Hello, and welcome to our channel. If this is the first time you are visiting our channel, please consider subscribing. We create and share high-quality and informative medical videos that will help each one of us make healthy choices and decisions in our daily life. We welcome all of you and appreciate your support and encouragement. We are committed to producing more medical videos that will benefit all of us. Thank you. Hey there viewers. Welcome to our channel. In today's video, we will talk about stroke. Here are the 5 questions and topics we will be covering in this video. From the answers to these 5 questions, I promise you will surely discover some life-saving facts and information about stroke, regarding its signs and symptoms as well as preventive actions that you need to be aware of. So let's get started. Number 1. What is a stroke? Number 2. What are some signs and symptoms that you need to watch for? Number 3. What are some of the risk factors that may lead to having a stroke? Number 4. Why should you know about this acronym, FAST? Number 5. What are the top 3 foods that you would want to eat regularly to prevent having a stroke? So, what is a stroke? We all know that depriving our brain tissue of getting oxygen and nutrients leads to serious health conditions, and one of them is stroke. This serious health condition occurs when the blood supply to the brain is interrupted or reduced, which causes your brain cells to begin to die in a matter of minutes. Therefore, having a stroke is a serious medical emergency that should not be ignored, and on-time medical interventions and treatments are critical. Note: if you are experiencing signs and symptoms of stroke, do not attempt to drive to the hospital. Instead, make sure you let someone else drive you. However, it is strongly advisable to call an ambulance so that the medical professionals can start life-saving interventions and treatments on the way to the hospital. Now that we define stroke. So, what are some risk factors that lead to having a stroke? There are so many health conditions and risk factors that may lead to stroke, and these include: Number 1. High blood pressure. If you suffer from a high blood pressure health condition, the blood vessels in your brain become weak and can rupture easily, causing blood leak and brain hemorrhage. Note: high blood pressure is the leading cause of strokes. Number 2. Tobacco. It doesn't matter if you smoke or chew tobacco, it leads to many health problems, and one of them is stroke. This is because the nicotine part of tobacco can lead to high blood pressure, which puts high pressure on your brain's blood vessels, causing them to rupture. And this is when the blood leaks into your brain, leading to a stroke. Moreover, the nicotine that tobacco contains makes your blood thick and more likely to clot, leading to the blockage of blood in your blood vessels. Number 3. High cholesterol. If you suffer from a high cholesterol health condition, this may lead to having a stroke. This is because if you develop fatty deposits in your blood vessels, and in case these deposits increase, they make your blood vessels even narrower. This makes it difficult for blood to flow easily through your arteries, which prevents your brain from getting much needed oxygen and nutrients. Moreover, these fatty deposits can break apart and form a clot, leading to a stroke or even a heart attack. When you experience a stroke, every minute counts. Therefore, fast and effective medical treatments and interventions are crucial. This is because these medical interventions can decrease the risk of experiencing brain damage resulting from having a stroke. However, without knowing the signs and symptoms of stroke, medical interventions that will be implemented may not be effective. This is because a stroke has to be diagnosed with high certainty before implementing any medical interventions. Therefore, knowing these life-saving signs and symptoms is very critical. So, what are the top 6 signs and symptoms of a stroke that you need to watch for? The top 6 signs and symptoms of a stroke include: Number 1. You may experience numbness or weakness to your face, arm, or your leg, particularly on one side of your body. Number 3. You may experience confusion, difficulty speaking, or you may even have a problem understanding speech. Number 4. Your vision may quickly change, and you may have trouble seeing in one or even in both of them. Number 5. You may experience dizziness, loss of balance, or lack of coordination and difficulty walking. Number 6. You may experience unexplained severe headaches. Now that we know some critical signs and symptoms of stroke, why should you know about this acronym FAST to possibly diagnose a stroke and prevent possible brain damage? So, let's break it apart. Number 1. The letter F is for facial drooping. This is when you watch for facial drooping. For example, you ask the person to smile while watching for signs of drooping from one side of their face. Number 2. The letter A is for arms. This is when you watch for arm weakness. For example, you ask the person to raise both arms and monitor drifting downward of one of the arms. Number 3. The letter S is for speech difficulty. This is when you watch for speech difficulties. For example, you ask the person to repeat a simple phrase and watch for slurred speech. Number 4. The letter T stands for time. If you suspect a person is having a stroke, make sure you call the ambulance right away. Timing is crucial, and every minute counts. Now that we went through some critical steps to diagnose and possibly prevent brain damage resulting from stroke, we can talk about some roles food plays in preventing a stroke. When we are talking about stroke regarding how we can prevent it, there are certain things that we cannot control, such as genetics. However, there are certain things that we can control and monitor closely, which are our diet and food intake. Note: consuming high saturated fat, trans fat, and cholesterol foods put yourself at increasing cholesterol levels in your body. Also, consuming too much sodium can increase your blood pressure levels. All these factors can put you at a higher risk of having a stroke. Now that we know how food can have an impact on having a stroke. So, what are some foods that are stroke fighters? Some of these foods include: Number 1. Oatmeal. Research shows oatmeal lowers your low-density lipoprotein LDL, bad cholesterol. This is because oatmeal has so many nutrients that keep your arteries clear, and therefore helping your blood flow efficiently through arteries and veins, including your brain vessels. Number 2. Onions. Onions are some of the richest sources of dietary flavonoids, which are potent antioxidants. It is scientifically proven that eating onions lowers the risk of having a stroke by up to 20%. Therefore, it is crucial to integrate onions into your diet regularly. Number 3. Salmon. Salmon is known to be rich in omega-3 fatty acids. These omegas play a significant role in reducing inflammation in the arteries while helping to improve blood flow, and therefore decrease the risk of developing blood clots. Thus, eating salmon once to twice a week will lower the risk of having a stroke. Note: tuna and mackerel are just as excellent in preventing a stroke as salmon. However, it is better to eat them non-fried. To summarize, experiencing a stroke can be very damaging to your brain and your body if ignored. So, it is crucial to know its signs and symptoms for early interventions and treatments. Also, you should not delay medical interventions and treatments when you suspect yourself or somebody else experiencing signs and symptoms of a stroke. Now it is your turn. Do you know of other foods that would prevent a stroke? Please share your experience in the comments below. Please don't forget to like and subscribe to our channel. Thank you.